Hi there once again, good morning. Dr. Krish Bab here. Today I'm talking about the longest coursing autonomic nerve of the body, the vagrant nerve, also called as the vagus nerve. The 10th cranial nerve arises from the medulla, exits from the skull through the jugular foramen, and enters the carotid sheath behind the carotid vessels, and travels all along the neck into the mediastinum, traverses the entire thorax, and exits as vagal trunks through the esophageal hiatus into the abdomen. The branches of the vagal nerves are traced up to the transverse colon. So its supply is so innumerable. It takes care of the parasympathetic supply of the entire neck area, the chest, mediastinum, as well as abdomen up to the transverse colon. Almost all abdominal organs are supplied by it except the adrenals. The vagus has got parasympathetic supply as well as skeletal muscle supply. Muscles of the larynx, pharynx, palate are supplied by the vagus nerve. The branches of the vagus are in that order from top down. The parasympathetic branches, first we'll deal. The pharyngeal nerve, the superior laryngeal nerve, superior inferior cardiac nerves, recurrent laryngeal nerve, branches to the esophageal plexus, branches to the pulmonary plexus, and exit as the right and left vagal trunks into the abdomen. The left vagus is anterior, supplies celiac branch and the hepatic branch and the anterior gastric branches. The right one is posterior, supplies the celiac branches and the posterior stomach branches as well. As I told you, a lot of muscles are innervated by the vagus in the larynx, pharynx, palate. Sometimes it's confusing to know all the branches and very discouraging also. But if you remember the rule of exceptions, you'll be able to understand better development as well as anatomy. We got larynx, pharynx, the palate and the tongue. They all follow the rule of exceptions. All the muscles of the larynx are supplied by the recurrent laryngeal nerve except the cricothyroid by the superior laryngeal nerve of the vagus. All the muscles of the pharynx are supplied by the vagus through the pharyngeal plexus except the stylopharyngeus supplied by the glossopharyngeal nerve. All the muscles of the palate again are supplied by the vagus except one muscle, the tensor villi palati. Earlier I discussed in one of the discourses. It is supplied by the mandibular branch of the trigeminal nerve. Again, tongue also has got an exception. All of its muscles are supplied by the hypoglossal nerve except the palatoglossus, which is supplied by this vagus nerve. If you remember these rules of exception, you'll be able to derive better anatomy knowledge of the head and neck. Vagotomy used to be done earlier, 2 decades or 3 decades back, for ulcer surgery, but it is now obsolete. The vagus is the seat of the daily visualized vasovagal reflex, vasovagal attacks, syncope, sudden bradycardia, hypotension, hypoperfusion, and blackouts because of this vagal stimulation. Of course, it has got its own nuclei in the brain, nucleus ambiguous, superior inferior cervical ganglia. If you want to read further, you can even update yourself about the vagal origins also. Thank you for listening. Have a great day. Do not forget to exercise your likes and dislikes on my discourses. Waiting for you. Thank you.